Welcome back. In the chapter of health programs in India, in today's session we will discuss about universal immunization program. Under the global smallpox eradication program, it was experienced that immunization is most powerful and cost effective weapon for the prevention, control and even eradication of a disease. So we see that the smallpox is completely eliminated from the world. It is eradicated. So we see that smallpox is no longer present. It is eradicated from the world with the help of vaccination. So we see that the smallpox eradication program is experiences that, or it is proving us that immunization is most powerful and cost effective weapon. So thereby we see that immunization is very powerful in the first place, and secondly, it is cost effective. Cost effective in the sense immunization is cheaper. It is affordable by the government as well as the community. It is powerful and cost effective weapon for the prevention, control and even eradication of a disease. Clear guys? Immunization is powerful as well as cost effective for the prevention, control and eradication of a disease, and this was proved by smallpox eradication program. In 1974, the World Health Organization officially launched a global immunization program. It was known as Expanded Program of Immunization. E stands for Expanded Program of Immunization. This program was directed for the prevention and control of six killer diseases. Okay, it was directed for the prevention and control of six killer diseases of the children. The six killer diseases were namely diphtheria, pertussis, tuberculosis in the first place, DPT, and we have tetanus, poliomyelitis, and measles. Okay, from T what do we have? Tetanus and tuberculosis. Tetanus, tuberculosis. D for diphtheria, P for pertussis and poliomyelitis, M for measles. Okay, D, M, P, T. Okay, order wise you can remember P square, T square. Diphtheria, measles, pertussis and poliomyelitis, T for tetanus and T for tuberculosis. Fine. These are the six killer diseases of the children which this program is aiming to prevent and control. It was called expanded because adding more disease controlling antigens of vaccination schedules. They added more disease controlling antigens of vaccination schedules, extending the coverage to all the corners of the country. So they extended this vaccination program to all the corners of the country, like the rural areas, underdeveloped areas, unserved areas, in such a hard to reach areas. In all the corners of the country, they extended the coverage, spreading services to reach the less privileged sectors of the society. So the poor, lower socioeconomic conditions, so those people who are belonging to that below poverty line, and the program has to reach the less privileged sectors of the society. That's the reason it was called expanded. Clear guys? It was called expanded because they added more vaccine schedules, disease controlling antigens of vaccine schedules. They extended the coverage to all corners of the country. They spread the services to the less privileged sectors of the society. Now we are moving on to the primary healthcare concept as enunciated in 1978 at Alma Ata Declaration. So the Alma Ata Declaration, you can see the Alma Ata conference held in Chicago. So it was they declared that the immunization is one of the strategies for reaching the goal of health for all by the year 2000. So we know multiple times we have studied the Alma Ata conference, the declaration of health for all by 2000. Under this Health for All 2000, they included immunization as one of the strategies for reaching the goal of health for all. So, immunization was one of the factor for reaching health for all by 2000. Moving further, the government of India launched the expanded, that is immunization program in 1978 with the objective of reducing the mortality and morbidity which is resulting from the vaccine preventable diseases. So what was the main aim? What was the main aim of the expanded program of immunization is to reduce the mortality. Mortality are the deaths and the diseases. Mortality is the death and morbidity are the diseases which are resulting from the vaccine preventable diseases. Okay, especially in the children, and to achieve the self sufficiency in the production of vaccines. The country must be self sufficient to produce the vaccines. Okay, further, in October 1985, UNICEF emphasized the goal of achieving universal immunization. So, what happened in 1985? The vaccine coverage should be done universally, was proposed by UNICEF. And by 1990, the global program now was renamed as the Universal Child Immunization. So, the expanded program of immunization, EPI, was renamed as a Universal Child Immunization in the year 1990. On 19th October 1985, Government of India renamed the expanded program of immunization, modified the schedule as Universal Immunization Program. It was dedicated to the memory of the late Prime Minister Mrs. Indira Gandhi. So we see that universal immunization program has two vital components. Very important, it has two vital components. In the first place is the immunization of pregnant women. So you can see the immunization of the pregnant women against the tetanus and immunization of the children in first year of life against the sixth expanded program of immunization target diseases, which we saw the 6 diseases. Okay. The aim is to achieve 100% coverage of pregnant women with 2 doses of tetanus toxoid. So, the aim of the universal immunization program is to achieve 100% vaccination of the pregnant women with 2 doses of tetanus toxoid, or if she is vaccinated in her previous pregnancies, give a booster dose, and at least 85% coverage of infants with 3 doses each of DPT, oral polio vaccine, 1 dose of BCG, and 1 dose of measles vaccine by the year 1990. So, the vaccine, the schedule, the immunization schedule, we will discuss at the end. There you can correlate with these, months and the newborn and everything. For now, remember the pregnant women, they are given 2 doses of tetanus toxoid. Okay, TT. TT is given to the pregnant women in about 100% pregnant women. In the children, 85%, at least 85% coverage of the infant who is born with 3 doses of DPT, OPV, oral polio vaccine, and BCG, 1 dose. Okay, this is 3 doses, this is 1 dose. And 1 dose of measles and BCG, 1 dose. Okay, measles, BCG, 1 dose, and DPT, OPV are given 3 doses each. The immunization services are being provided through the existing healthcare delivery system. So, who are providing this immunization services to the community? The healthcare delivery systems, that is MCH centers, PHCs, sub-centers, hospitals, dispensaries, ICD units, integrated child developmental units. In 1992, the immunization program became a component of Child Survival and Safe Motherhood program. So in 1992, the program was became one of the component of Child Survival and Safe Motherhood program. It was recommended to cover 100% among infant also. So we see here initially it was 85% coverage of infants with 3 doses of DPT, OPV and 1 dose of BCG and measles. But once the program became a component of the Child Survival and Safe Motherhood program, it was recommended to do the 100% coverage even among the infants. In 1995, the polio immunization program was launched as a strategy to eradicate poliomyelitis. So, very important in 1995. Okay, in 1995 polio. Okay, 95 polio. P and this is 5. 95. Okay, polio. In 95. 9 and P. Polio. 95. And the immunization program was launched as a strategy to eradicate the poliomyelitis. In 1997, 95 polio. 97 immunization activities have been an important component of National Reproductive and Child Health Program. Now, the immunization activities were also included. It was also a component of National Reproductive and Child Health Program. In 2005, immunization schedule was revised. It incorporated the hepatitis vaccine, 2 doses of Japanese encephalitis vaccine in the selected endemic districts. And this Japanese encephalitis vaccine, the first is given during 9 to 12 months and the second during 16 to 24 months. The 2 doses of measles vaccine, the first dose of measles vaccine is given from the month 9 to 12 months and the second again from 16 to 24 under the National Rural Health Mission. So let us see the Japanese encephalitis. There are 2 doses. The first dose is given from 9 to 12 months, right? 9 to 12 months and second 16 to 24. The first dose 9 to 12, the second dose is given from the month 16 to 24. So we see the measles vaccine also follows the same schedule. It has 2 doses. The first dose from 9 to 12 month, okay, 9 to 12, 16 to 24, okay. And then also the Japanese encephalitis follows the same schedule. It has 2 doses. The 2 doses of Japanese encephalitis, first during 9 to 12 months, second during 16 to 24. Again measles vaccine, first during 9 to 12 months, second during 16 to 24 months under the National Rural Health Mission NRHM. In 2012, the Government of India declared 2012 as the year of intensification of routine immunization. About the routine immunization we will study in the upcoming slide. Now in 2012, Government of India, they declared that 2012 is the year of intensification of routine immunization. In 2013, Government of India along with SC Asia regions declared the commitment towards measles elimination. Southern Eastern Asia regions, they declared the commitment towards measles elimination. So in 2013, the Government of India is declaring a commitment. They are making a commitment to eliminate the measles and congenital rubella syndrome control. Okay, elimination of measles. Okay, you can see. You can remember like this, E, elimination of E is like this, elimination of measles, and control of, they want to control rubella. In 2014, by the year 2020. In 2013, they are making a commitment that they will eliminate measles and they will control rubella. In 2014, India was certified as a polio-free country. Very important, in 2014, finally, India was declared to be polio-free country. 2014. Again, in the next slide also we get it about the polio-free country. Although the target was universal immunization in 1990, in practice, no country, even in the industrialized world, has ever achieved 100% immunization in the children. Though our target is universal immunization, even the most developed, most industrialized country also is not able to achieve 100% immunization in children. Universal immunization, therefore, it is best interpreted as implying the ideal that no child should be denied immunization against tuberculosis, diphtheria, whooping cough, tetanus, polio, and measles. So they are saying that the universal immunization should, therefore, what they have to do? They have to say that the no child in the country should be denied or should be deprived of immunization. No child should be deprived of immunization against diphtheria, whooping cough, tetanus, polio, measles, tuberculosis. Okay. It is, however, generally agreed that when immunization coverage reaches about 80% or more, then the disease transmission patterns are so severely disrupted as to provide a degree of protection even to the remaining children who have not been immunized because of herd immunity. So we see that once the immunization coverage is reaching a figure of 80% or more, then the disease transmission pattern in the community will be disrupted markedly, and thereby the community itself will provide the protection against the diseases. So the degree of protection for the remaining children who have not been immunized will be provided by the herd immunity. It is also important that the children are immunized during the first year of life, and the levels of immunization should be sustained so that each new generation is protected. So we need to immunize the children so that the level of immunization will be sustained through the generations over generations, and we can protect the newer generations from these diseases. To strengthen the routine immunization, the Government of India has planned the State Program Implementation Plan. So we see Program Implementation Plan. This consists of support for alternative vaccine delivery from the primary health center to the sub-center and outreach sections. Deploying retired manpower to carry out immunization activities. So we see the retired manpower like those physicians or those who are retired, the healthcare workers. They can carry out the immunization activities in the urban slum areas, underserved areas where the services are deficient. The mobility support, so the vaccine immunization has been made mobile. It is given at the doorsteps to the district immunization officer as per the state plan for monitoring and supportive supervision. Review meeting at the state level with the districts at 6 months interval. So at the interval of about 6 months, we need to have a review meeting at the state level with the districts, especially 6 months gap. The training of A&M, auxiliary nurse midwives, the cold chain handlers, mid-level managers. So the mid-level managers, we need to train them well. The refrigerator mechanics also need to be trained. Support for mobilization of the children to immunization session sites by ASHA workers, women self-help groups, etc. And also the printing of the immunization cards, monitoring sheets, cold chain chart, vaccine inventory charts, etc. In addition, the central government is also supporting in supply of auto disposable syringes. So we'll see in the picture in the upcoming slide, we have this auto dispensable syringes which lock after the first use itself. Downsizing the BCG vial from 20 doses to 10 doses to ensure that BCG vaccine is available in all the immunization session sites. So, using 20 doses, sending 20 doses, and then wasting them, instead of that, the 20 doses have been brought down to 10 doses so that they can be made available in all the immunization session sites. Strengthening and maintenance of the cold chain system. Cold chain will be studying in epidemiology. So, we are strengthening and maintaining the cold chain system in the states, and supply of vaccines and vaccine van. So, we know cold chain, we need to maintain the proper temperature of the vaccines and their proper delivery has to be done. So, once the temperature reaches, we will have an indication on the vaccine itself. It will indicate that this vaccine has not got the optimum temperature and it is unsuitable for usage. So all of that we'll study in epidemiology chapter, that is cold chain. And the supply of vaccines and vaccine ban. Moving to the pulse polio immunization program. The pulse polio immunization program was launched in the country in the year 1995. Under this program, the children under 5 years of age are given additional oral polio drops in December and January every year on fixed days. So we know in December and January on the fixed days we have polio drops will be provided for the children. So under this program, which are the children age group? Under 5 years of age. The children who are aged under 5 years of age will be given the oral polio drops. Okay, OPV, oral polio vaccine or oral polio drops will be given to the children, especially in December and January every year on fixed days. From 1990 to 2000, house to house vaccination of the missed children. So they will conduct camps wherein the oral polio drops will be provided to all the children. The parents have to take them, or if the school visits will be done. If in case the children miss out, house to house vaccination of missed children is done. Was introduced in the year 1999 to 2000. The NID's rounds cover approximately 172 million children. So we see that approximately 172 million children are covered, and these rounds cover 40 to 80 million. NIDS rounds will cover about 40 to 80 million children. In addition to this, the large scale multi-district mop-ups have also been conducted. In addition to these house to house vaccinations, the multi-district large scale mop-up, okay, the last again conducting camps, and then we provide the OPV. As a result, only one case of polio was reported in 2011 in the month of January. So we see that because of this, widespread awareness, as well as the camps being conducted, the services being provided at door to door. So such house to house vaccination is done. Every year we are giving free vaccine to the children. So this resulted in the only one case of polio appearing in the month of January in 2011. As on 25th of February 2012, India was removed from the list of polio endemic countries. So we see that by 2012, India was removed from the list of polio endemic countries, and 27th March 2014, India was certified as a polio free country. So we see 2014, India is considered as a polio free country. Introduction of the hepatitis B vaccine. So we see that the In 2011 and 2010, Government of India universalized the hepatitis B vaccination to all the states, union territories in the country. So the Government of India has now universalized this hepatitis B vaccine to all the countries, to all the union territories in the country. Monovalent hepatitis B is given as an intramuscular injection to the infant. You can see the monovalent hepatitis B vaccine is given to the newborn infant at 6, 10, and 14 weeks, along with the series of DPT and polio vaccine. So, along with the DPT and polio vaccine, hepatitis B vaccine is given in the 6, 10, and 14 weeks. When we study the immunization chart in the last, you will correlate with this. So, we see that the IM intramuscular injection is given to the infant at 6, 10, 14. Hepatitis B 6, 10, 14. Okay. 6 plus 4 is 10, 10 plus 4 is 14. So, 6, 10, 14 weeks, the hepatitis B vaccine is given. In addition, 1 dose of hepatitis B is given for the institutional deliveries within 24 hours. Those deliveries which are occurring at the hospitals, the children who are born at the hospital soon after the institutional delivery, we are giving a 1 dose of hepatitis B. Introduction of Japanese encephalitis vaccine. This program was launched in the year 2006 to cover 104 endemic districts in the phased manner under SA 1414-2 vaccine, 14142 vaccine. So we see that the Japanese encephalitis was launched in the year 2006. Okay, Japanese encephalitis in the year 2006 in about 104 endemic areas. And you see that it is using SA 14142 vaccine, 1414, 1414, anything. It is using this vaccine. You can see on the vaccine here, the strain has been given. You can see the strain. You can see the strain here, SA 14142 vaccine has been provided. So we see that to all the children, it is imported from the China. The single dose of the Japanese encephalitis vaccine is given to all the children between 1 to 15 years of age through campaigns. So via the campaigns, we are giving the Japanese encephalitis vaccine to all the children who are aged 1 to 15 years. The Japanese encephalitis vaccine is being integrated into routine immunization. Now we are integrating this Japanese encephalitis vaccine in our routine immunization in those districts where campaign had already been conducted to immunize the cohort children by vaccinating 2 doses in 9 to 12 months and 16 to 12 months. Okay. So you just remember that this program was launched in the year 2006. It uses SA 14142 vaccine, and single dose is given to all the children who are aged 1 to 15 years. Now it has been integrated under the routine immunization, and the children especially it is conducted in those districts where the campaign has already been conducted to immunize the cohort of the children. They were vaccinating 2 doses of 9, especially at 9 to 12 months and 6 to 14 months. Okay, 16 to 14 months, 9, 12, 16, 24. Okay, I'm sorry, we saw that 9 to 12, like we saw in the measles, 9 to 12 the first dose was given, and the second dose 16 to 24 months. Okay, moving further, introduction of measles vaccine second opportunity. So we're discussing about the measles vaccine now. The measles vaccine second opportunity. So, in order to accelerate the reduction of measles related diseases and the deaths because of the measles disease or the measles leading to death, in order to accelerate the reduction, we need to bring down, in order to bring down the deaths and the diseases, the second opportunity for measles vaccination is implemented. The National Technical Advisory Group on Immunization, they recommended that we need to introduce 2 doses of measles vaccine to children between 9 months and 10 years of age. So we see that they said 9 months to 10 years of age, 2 doses of measles vaccine have to be implemented. So we see that it has been done through the Supplementary Immunization Activity, SAI. For the states where the coverage for the first dose of measles vaccine is less than 80%. In those states where the measles vaccine was covered for less than 80%, the supplementary immunization activity, through the supplementary immunization activity, we are providing the measles vaccine, the introduction of second dose of the measles vaccine to the children who are aged 9 months to 10 years. In states where the coverage of measles is more than 80%, then the second dose of vaccine is given through routine immunization at 16 to 24 months. So we see that in less than 80% coverage, we have supplementary immunization activities who are providing the second dose of measles. If it is more than 80% coverage in the areas, then in those states or in those states, then we see that the second dose of vaccine will be provided in the routine immunization. Introduction of pentavalent vaccine. The pentavalent vaccine includes the diphtheria, pertussis, tetanus, DPT, hepatitis B and HIV, that is Haemophilus influenza B vaccine. Okay, DPT, that is diphtheria, pertussis, tetanus, followed by we have hepatitis B and Haemophilus influenza. So we see that India introduced this pentavalent containing DPT, hepatitis B, HIV vaccine in 2 states, that is in Kerala and Tamil Nadu. It was done under the routine immunization program from December 2011. So the pentavalent vaccine contains all these 5, okay, pentavalent, DPT, H and H. And then the DPT and hepatitis B, out of which DPT and hepatitis B, vaccination requires 6 injections to deliver the primary dose. With the introduction of this pentavalent, initially what the diphtheria and hepatitis B required 6 injections, okay, 6 injections were required to give 1 dose. But now with the introduction of this pentavalent vaccine, a new antigen, that is HIB, so we see that a new antigen, that is Haemophilus influenza B, is being added. It is protecting against the Haemophilus influenza type B. It has been associated with pneumonia and meningitis, and the number of injections have now been reduced to 3. The vaccine has also been expanded to the 6 other states, which is not very important. You can just have it on your mind. Like it has been expanded to Haryana, Jammu and Kashmir, Gujarat, Karnataka, Goa, Puducherry. Now the pentavalent vaccine is being given in all the states. Initially it was in these areas. Initially the India introduced the pentavalent vaccine in 2 states, that is Kerala and Tamil Nadu. Very important. In first it was introduced in Kerala and Tamil Nadu. Later the program, according to this program, the pentavalent vaccine has been provided to all the states. Now moving on to the very important, that is Mission Indradhanush. Mission Indradhanush is under the Ministry of Health and Family Welfare. This Ministry of Health and Family Welfare, they launched the program Mission Indradhanush, which is depicting the 7 colors of the rainbow. You can see the 7 colors of the rainbow have been depicted under this scheme. In December 2014, it was launched. It was done to fully immunize 90% of the children who were unvaccinated, or who were partially vaccinated, or those that have not been covered during the routine immunization rounds. So by the year 2020 we need to fully immunize 90% of the children. The goal of this mission Indradhanush is to immunize 90% of the children by the end of the year 2020. Okay. The government of India launched this scheme on 25th December 2014. Mission Indradhanush 2014. It is to cover the children who are unvaccinated, partially vaccinated against the 7 vaccine preventable diseases, which is diphtheria, whooping cough, tetanus, polio, TB, measles, and hepatitis B. The goal is to vaccinate all the under 5 by the year 2020. The government of India introduced the intensified mission Indradhanush. Now, the mission Indradhanush has been intensified. Intensified mission Indradhanush uh, in the few districts and urban areas of the country, so that they can achieve the target of more than 90% coverage. So the main goal was to achieve more than 90% coverage, right? So they introduced intensified mission in the Dhanush in few selected districts, in few urban areas, so that they can achieve this target of more than 90% coverage. Intensified mission Indradhanush will focus on the children up to 2 years of age, and also it focuses on the pregnant women who have missed out the routine immunization. So if a pregnant woman or the infant has missed out his or her routine immunization, then up to 2 years of age the children have been focused under this mission. However, the vaccination on demand to children up to 5 years of age will be provided during the intensified mission in the Dhanush. On demand, we have increased the vaccination up to 5 years of age, provision of vaccination up to 5 years of age during the intensified mission in the Dhanush rounds. Intensified mission Indradhanush immunization drive will spread over 7 working days, starting from the 7th of every month. So we see that this program starts from the 7th of every month, and it is starting from the 7th of every month and goes on for the 7 working days. These 7 days do not include the holidays, Sundays, or the routine immunization days planned in that week. So we see that we have these 7 working days which they are going to take up, and it is started from the 7th of every month. Okay, if 8th is a Sunday, we are not taking that day. If it is a holiday, if there is some festival and if the holiday, we are not considering it. And the routine immunization days planned in that week, not considered. Moving further to the new vaccines which have been included. So the new vaccines in April 2016, India has introduced the use of fractional dose IPV in the routine immunization program. And we have fractional dose IPV. It has been launched in 8 states. Again, not important the states, just for your knowledge: Odisha, Andhra Pradesh, Telangana, Karnataka, Tamil Nadu, Puducherry, and Maharashtra. Very important, new vaccines, fractional dose IPV was launched. Since March 2017 has scaled up nationwide in all the 36 states, 2 fractional doses of IPV, that is 1.1 ml, are given intradermally at 6 to 14 weeks. So we see that IPV vaccine has been given at 6 to 14 weeks intradermally, and 2 fractional doses are given: 0.1 ml, 0.1 ml. 2 fractional doses of IPV 0.1 ml are given intradermally at 6 to 14 weeks. On 5th Feb 2017, Ministry of Health and Family Welfare launched the measles rubella vaccination campaign. So we see that the measles rubella vaccination campaign was launched by the Ministry MRHM, Ministry of Health and Family Welfare. Following the campaign, measles rubella vaccine was introduced in the routine immunization. Following the Ministry of Health and Family Welfare, which launched the MR vaccination camp, after which the measles and rubella was introduced in the routine immunization. They're replacing currently giving 2 doses of measles vaccine at 9 to 12 months and 16 to 24 months of age in the 5 states of Union Territories. So, this measles rubella vaccination is replacing the 2 doses of measles, which was currently given at 9 to 12 months and 16 to 24 months. This has been replaced, and we have MR vaccine. Okay. In March 2016, rotavirus was introduced in 4 states: Haryana, Himachal Pradesh, Andhra Pradesh, Odisha. So we see that the fractional dose IPV was launched. The fractional dose IPV, measles rubella vaccination campaign. So we see fractional dose IPV, measles rubella vaccination campaign. Moving further, rotavirus vaccine was introduced under the Union Minister for Health and Family Welfare. He announced the expansion of rotavirus vaccine under the Universal Immunization Program in 5 additional states. He included them, that is Assam, Tripura, Madhya Pradesh, Rajasthan and Tamil Nadu. He included the rotavirus vaccine. Okay. And in 2017, of 13th May of 2017, Union Minister for Health and Family Welfare announced the introduction of another new vaccine, that is pneumococcal conjugate vaccine, that is PCV, in the Universal Immunization Program. Currently, the pneumococcal vaccine is being rolled out to approximately 21 lakh children in Himachal Pradesh, and also it has been rolled out in the parts of Bihar, Uttar Pradesh. This will be followed by introducing it in the other states like Madhya Pradesh, Rajasthan. And also it has been expanded throughout the country in a very phased manner. You can see the pneumococcal 13 valent, okay, PCV conjugate vaccine, diphtheria, CRM 197 protein. So we see that pneumococcal vaccine, okay, pneumococcal conjugate vaccine is introduced. So what are the new vaccines which are introduced? The fractional dose IPV, and we have measles rubella vaccination campaign was done, and followed by we have rotavirus vaccine, which was introduced by the Union Minister for Health and Family Welfare. Again, the Union Minister for Health and Family Welfare also introduced pneumococcal conjugate vaccine. Implementation of routine immunization. The routine immunization is targeting to vaccinate 26 million newborns each year. So we see that it's quite vast. So we see the routine immunization wherein 26 million newborns every year are vaccinated with all the primary doses, and 100 million children of 1 to 5 years are vaccinated with a booster dose of universal immunization program vaccines. In addition to this, the 30 million pregnant women are targeted for the tetanus toxoid vaccination each year. So we see that under the routine examination, 26 million are given primary dose, 100 million children of 1 to 5 years are given booster dose, and the 30 million, okay, 30 million pregnant women have been given the tetanus toxoid vaccination. To vaccinate this cohort of 156 million beneficiaries and 9 million immunization sessions are conducted. Majority of these sessions are conducted at a village level. Okay, Asha, Anganwadi workers, they support the auxiliary nurse midwife by mobilizing the children to session site. So these Asha workers and ANM workers, they will bring in awareness about the vaccination, and they will they will provide the mobilization of the eligible children for vaccination to the respective session sites, and they try to ensure that no child is missed. The door-to-door inquiry will be done, and they will make sure that no child is missed. Asha is also provided with an incentive of rupees 150 sessions for this activity. So this Asha worker for performing this activity will be provided with rupees 150. To ensure the potent and safe vaccines will be delivered to the children, a network of 27,000 cold chain points have been created across the country, so that the vaccine are not, they are delivered very safely quality and in a potent and a safe vaccines have been delivered to the children in order to provide safe and good vaccines to the children. The 27,000 cold chains points have been created across the country. To ensure the safe injection practices, Government of India endeavors to ensure the continuous supply of injection safety equipments. So we need to provide AD syringes, reconstitution syringes, hub cutters and waste disposal bags. So we see AD syringes which will lock reconstitution syringes, and we have hub cutters and waste disposal bags. What are the achievements? The biggest achievement of immunization program is the eradication of smallpox. One more significant milestone is India is free of poliomyelitis. So we see the smallpox was eradicated with this immunization, and we have the polio free India, okay, in the year 2014. Vaccination has contributed significantly in the decline in the cases and deaths due to vaccine preventable diseases. Because of the vaccination, the deaths as well as the preventable diseases, the cases and deaths due to the vaccine preventable diseases have declined. Lastly, we will just brush up with the immunization schedule. Okay, this we will also be studying in detail in the chapter of epidemiology. For now, we will focus on the immunization schedule of the infants, children and pregnant women. In pregnant women, the tetanus toxoid first dose, so first we'll see what is the vaccine, when to give this vaccine, in what dose, and what is the route and the site of the vaccine. For the pregnant women, the tetanus, TT first dose, second dose and a booster dose. First dose is given early in the pregnancy, 0.5 ml intramuscularly, and it is given on the upper arm. Okay. Tetanus toxoid, the second dose will be given 4 weeks after the first dose. Okay. Early in pregnancy, it could be in the second month, first trimester. Okay. So early in the pregnancy, we are giving the TT. Soon after the 4 weeks, that is about 1 month later, we are giving TT, the second dose. If they have received 2 doses of TT in a pregnancy previously, within the last 3 years, then we only give them a booster dose. Instead of giving first dose and second dose, we are just providing a booster dose if she has received the vaccination in the previous 3 years. The dose again is 0.5 ml and it is given intramuscularly in the upper arm. Now we are moving on to the vaccination schedule of the infants. The BCG vaccine at birth or early as possible till 1 year of age. So BCG can be given as soon as the baby is born, or the time period of 1 year it can be given. 0.1 ml is given, 0.05 ml until the baby is 1 month of age. We have to give 0.05 ml. It is given intradermally in the left upper arm. Hepatitis B dose at birth or as early as possible within the 24 hours, we need to give the hepatitis B vaccine. 0.5 ml again intramuscular and anterolateral side or mid thigh. It is given in the anterolateral side as well as of the mid thigh. Oral polio vaccine, the 0 dose at birth, it is given at birth as early as possible or within the first 15 days. We give OPV, which is just 2 drops is given to the baby. Okay, as soon as the baby is born, we have to give just 2 drops orally. And OPV, the other the doses, the first, second and third is given at 6, 10 and 14 weeks. 2 drops again orally. Pentavalent 1, 2 and 3. Pentavalent dose 1, 2 and 3 are given at 6, 10 and 14 weeks. It can also be given till 1 year of age. 0.5 ml is given intramuscularly in the anterolateral side of the mid-thigh. Rotavirus. Rotavirus is given at 6 weeks, 10 weeks, 14 weeks. It can also be given till 1 year of age. We are giving 5 drops of rotavirus, 5 drops orally. IPV vaccine, we are providing 2 fractional doses at 6 and 14 weeks of age. 0.1 ml intradermally, 2 fractional doses are given intradermally in the right upper arm. Measles MR, 2 doses, right? Okay, so 9 completed months to 12 months can be given till 5 years of age. 0.5 ml subcutaneously in the right upper arm. Japanese encephalitis, the 9 completed months to 12 months again, 0.5 ml subcutaneously should be given. So Japanese encephalitis should be given subcutaneously. Vitamin A first dose should be given at the 9 completed months with the measles and rubella. That is 1 ml of vitamin A is given, 1 lakh unit after the completion of 9 months along with the measles and rubella. For the children 16 to 24 months, we are giving DPT, measles, MR, that is second dose, DPT is first dose, and we are giving OPV booster and Japanese encephalitis second dose. The DPT and measles are 0.5 ml. DPT is intramuscular anterolateral side of mid-thigh. In the measles, it is 0.5 ml. Measles from 16 to 24 months again, it is given subcutaneously in the right upper arm. OPV booster 16 to 24 months, 2 drops. Okay, OPV again 2 drops orally has been provided. Japanese encephalitis, again we have studied all of this, 16 to 24 months, 0.5 ml subcutaneous in the left upper arm. Vitamin A, the second dose to the 9th dose. It can be given from the period of 16 to 18 months, then 1 dose every 6 months up to the age of 5 years. That is 2 ml, 2 lakh international units have been provided orally. DPT booster, it is given for 5 to 6 years kid, 0.5 ml intramuscular upper arm, and tetanus toxoid again from 10 years to 16 years of age kid can be provided with 0.5 ml intramuscularly in the upper arm. So this was about the national immunization schedule. We will make a complete different video and try to make the mnemonics and try to remember all of the the dose, the route, the site, and the vaccine and everything. So thank you. With this we come to an end of National Immunization Program, Universal Immunization Program. If you like the video, hit the like button and subscribe.